Obamacare is right around the corner, so I wanted to address it right now today. I've asked my guest, Doug Whiteman, to join us. He spent 11 years with the Associated Press as a Washington-based consumer and business reporter, and he joins us today from Bankrate.com as its insurance analyst. Welcome to the show, Doug.
Thanks very much. Good to be here.
So as I said, Obamacare is upon us right now. We're just weeks away, and they're going to be accepting applications. And Bankrate.com just commissioned a survey where they found a disturbing lack of consumer education. What's that all about?
Well, we conducted a survey. We gave a multiple choice question, and we asked what question would you most like answered about Obamacare? And we were a bit shocked that 15% said what they most wanted to know was, what is Obamacare? As you say, that is disturbing, though maybe on one level it's not so surprising because this law is very, very complicated. It runs over 900 pages. There are a lot of nuances to it. It's very, very complex. But at the same time, it has been called the most important piece of social legislation since Social Security. This is going to affect people's lives, particularly the 15% of Americans who have no health insurance. So people really need to seek out information and learn more about what's going on.
Are people spending more today before or on the cusp of Obamacare than they were a year ago?
That's a difficult question to answer, and we did hear the president say that the cost curve, that Obamacare is bringing down the increases in spending on health care, and I believe that according to most private economists, that would be incorrect. They say that the spending was, in fact, coming down in 2009, which was a year before the Affordable Care Act was signed into law by the president. Mm-hmm. If there is a decrease in health care spending, one reason could be the economy. People were spending less on health care as they were spending less in general, just trying to keep their expenses down. So really, it's too early to say whether there's any impact on health care costs or spending because of Obamacare.
Well, getting back to the survey, what did you find as far as whether people are feeling more negative or positive above those that don't know what it is?
Yes, we asked, how do you feel about Obamacare related to your own health care, and especially compared with the way you might have felt a year ago? 28% said they were feeling more negative than they were a year ago. 14% said they were feeling more positive. So that's a 2-to-1 ratio. It could be that there is just a lot of confusion. There is a lot of negative information out there. People are hearing about efforts to defund the law, to kill it. And in fact, going back to our original question, 20% wanted to know most about Obamacare. Is it really going to happen? Yeah. People need to know that, no, it is very much alive. The health exchanges, the online marketplaces where people will be able to shop for coverage and compare plans and take advantage of the new federal subsidies, those are still scheduled to open in states across the country on October 1st.
Mm-hmm. October 1st, which is really the week that this particular segment will air. My guest is Doug Whiteman. He joins us today from Bankrate.com. He is Bankrate.com's insurance analyst. And of course, we're talking about Obamacare, which is the largest insurance effort or plan that you'll ever see because it covers the whole United States. Doug, let's get into some of the features of Obamacare. I'm just going to let you start and take us from the beginning. First of all, is it starting out anyway? Do you think people are going to be spending more than they're currently spending or less than they're currently spending?
Well, that is a very, very difficult question to answer, and there have been a lot of headlines out there saying that cost of health insurance is going to skyrocket under Obamacare, and our view is that it's really too early to say. You really can't draw any kind of a general conclusion on whether rates are going up or whether they're going down. There are just too many variables. List prices for plans in the Affordable Care Act exchanges, the marketplaces, may appear to be much higher than the rates for the plans that are currently available in the individual insurance market. But you have to remember the new plans are required to offer a list of 10 essential benefits that weren't required previously. These include emergency care, hospitalization, prescription drugs. The new plans also have to cover people with pre-existing conditions, and there will be no caps on coverage. Previously, we had very, very skimpy and cheap plans, and they were favored by young, healthy people. A lot of these headlines are talking about costs going up in particular for young people. That's because these very skimpy, bare-bones plans will no longer be available in the individual insurance market.
So it's not apples to apples, and I think that's a very important distinction to make. It's one thing you'll hear a headline that it's going to cost, X percentage more for a 27-year-old. I've seen some numbers that have pointed to 97% more premium for a 27-year-old. Young women will be paying 55% more in most states. And yet what you're saying, it's not apples to apples because Obamacare requires that there are no pre-existing condition rules and that you'll get 100% payment for all these other services that you mentioned on that list?
That's right. It requires the plans to be much more comprehensive than they were previously.
Mm-hmm.
It's also important to note that the exchange plans will offer federal tax credits, subsidies, depending on your income, that will cut the costs. According to the Department of Health and Human Services, in some cases, the costs will be cut to zero. We have seen headlines saying that the average monthly premium for a benchmark Obamacare plan for an individual will be $328. Now, I certainly would not consider that cheap, but the thing to remember is that very few people using the exchanges are going to pay that full price because of the tax credits or the subsidies. And in fact, the government has said that more than half of people who are uninsured now could wind up paying $100 or less per month for insurance in the exchanges because of the tax credits. And they're available for people earning up to 400% of the federal poverty level, and that is about $46,000 a year for an individual or a little over $94,000 a year for a family of four.
And you're saying it's 400%, so it's 4 times that number.
No, that
number
is
includes
400% of the federal poverty level.
Oh, it is? Wow.
Right, which would be $46,000 for an individual or $94,000 for a family of four.
So after those thresholds have been met, income-wise, then the subsidies decline, or are they cliff? There are no subsidies?
Right, there are no subsidies for people earning above those levels. But again, the exchanges are really geared toward people for whom health insurance might not have been accessible before, the people who are currently uninsured, in many cases because the costs were out of reach for them.
Mm-hmm. So when you see a headline that says that the premium increases are going to rise, just remember that it's not quite so simple because there will be federal tax credits which will lower the person's taxes and, in a sense, be a reimbursement for the monies paid out. Doug, what are the first steps now that it's really the eve of this occurring? What are the first steps people need to take right now?
Well, people need to get better informed. They need to seek out resources, and there are good resources out there. We have a lot of information available at bankrate.com/health insurance, the federal government's healthcare.gov website, which will be operating many of the exchanges in many of the states. That has a lot of good, very basic information. There is information out there if you seek it out, and it is very important for people to become better informed, particularly the 15% of Americans who are currently uninsured, because that's very dangerous to go without health insurance.
Mm-hmm.
One serious illness or serious injury can seriously set you back economically.
How are corporations dealing with these changes now? You know, we're seeing some changes in these plans, but can you give me just an example of how a large corporation may make a change related to Obamacare?
Well, the employer mandate, which requires companies with 50 or more employees to offer their full-time employees coverage, that employer mandate was put off until 2015. So I don't think we'll see many changes at the corporate level until next year or beyond. We have seen some announcements at some firms. For example, they will no longer cover the spouses of employees if the spouse has coverage through his or her own employer. I do believe that some of these changes have been in the works for a while just because we have seen the cost of health insurance going up. It has become very expensive, particularly for companies that perhaps have had more generous benefits than some other companies. It has been very easy for all family members to say, well, we'll be covered by this employer and not that employer because the benefits are more generous here.
Well, the irony is that while these companies may be taking people off their health insurance rolls because the person's spouse has insurance, the other company that a spouse works for may be taking them off the rolls, and they may be finding those people or other people in the same quantities back on the original company's rolls. So it's not necessarily a win-win. It may all end up to be kind of the same in the wash.
That's very true. And companies will balance whether they want to offer health insurance to all of their employees or they'll pay a penalty of $2,000 to $3,000 per employee. There are a lot of math equations that companies and individuals will have to figure out. For example, individuals will have to figure out whether they want to go without health insurance or pay the individual mandate penalty, which is $95 in the first year if you don't have health insurance.
Mm-hmm. Boy, it is very complicated, so you have to get educated. And one way you can do that is go to the bankrate.com website, as well as the government websites. I think Kaiser Healthcare also has a website. My guest is Doug Whiteman, insurance analyst for bankrate.com. Thanks for joining us, Doug.
Thanks very much.